Hello and Assalamu alaikum. Welcome to another episode of Dentistry with Dr. Danial. So here is a wonderful case. Patient presented to us with complaint of pain in the upper left segment, and he said that he had a root canal done just 3 to 4 months ago, and was waiting for the pain to go away, but the pain hadn't gone away, which is why he couldn't get a crown over it. And he also had a very specific kind of pain. He said that I have this area over my gum, just I'm close to where my gum and cheek meet, and there is a swelling there, and it constantly keeps on hurting. And I went to the dentist, and they said everything looks okay. So this is the panoramic view that the patient got latest. So I took a periapical X-ray and looked at the core buildup was not very nice, very poor contact. But at first glance, the root canal seemed absolutely normal on the periapical. But like every case that I start, I always make sure that I get a CBCT and a three-dimensional image, because that's the gold standard for treating your patients now, because there's so much information that you will miss out on, especially if you do not have a 3D CBCT. So this is what the CBCT looked like. First thing we noticed on the 3D rendering is that we saw that there was a big hole here, a perforation in the buccal cortical plate that led to an understanding of why the patient felt a swelling in the gum and pain in the specific area. Again, on the panoramic view, very less information, but as soon as we move to the three-dimensional view, and absolutely mind-blowing, right, at how important three-dimensional imaging is. So at when we looked at the periapical, we saw that the obturation was almost at the apex, everything looked okay. But as soon as we moved to the three-dimensional image, the previous doctor actually missed out on the buccal canal. There's absolutely no instrumentation, nothing there. And that is leaking into the bone right here, causing inflammation, pain, and problems to the patient. So this is how three-dimensional imaging absolutely makes things so much more clear for us as clinicians, and makes sure that we give our patients the best work that we can. This is the axial view, to the top to bottom view, and here also we can actually very clearly see that there hasn't been any instrumentation, which is why this canal is absolutely not instrumented. So it's not rounded, which is how we know that it has absolutely not been instrumented at all. So they went through the chamber, found one canal, and just cleaned and obturated that one canal, and this particular canal has not been instrumented even, and hence this is where the infection starts. You can very clearly see going all the way down. The root separates. This is where the infection is. We've got sinus involvement as well. We've got perforation of the buccal cortical plate. So a lot of things happening for this patient, primarily because of either lack of imaging on the previous dentist part, or this poor instrumentation, or poor knowledge of a root canal system. So this is a very, very important case, which will highlight how important, in fact, 3D imaging, CBCT is in dentistry. Thank you very much.